A tummy tuck or lipoabdominoplasty is a surgery designed to reshape the entire trunk. When I perform lipoabdominoplasty, I do liposuction of the anterior trunk, the waist, the flanks, and sometimes the back. I tighten the abdominal wall muscles that may have been stretched out with pregnancy, and I remove the entire lower abdominal skin so the patient is left with one lower abdominal scar and a scar around the belly button, but also a narrower waist and a tight, flat stomach. The ideal candidate for a full tummy tuck is a patient who has loose skin above and below the belly button and diastasis of the rectus muscles or separation of the rectus muscles above and below the belly button. These patients are going to be best served with a full tummy tuck. The patients who are usually ideal candidates for this are women who have had children, who have experienced pregnancy, or people who have gained and lost a lot of weight. Full tummy tuck is performed under general anesthesia. It usually takes around 2 to 3 hours. The patient goes home the same day. We see them the day after surgery and frequently in the first week or so of their surgery. Drains will usually come out around 7 days. Patients can return to work around 7 to 10 days and must refrain from exercise for the first 6 weeks. A mini tummy tuck can be performed in patients who have limited excess skin that's restricted only below the belly button and may or may not have separation of the abdominal wall muscles only below the belly button. Another question I get a lot is how soon after having children or having a weight loss surgery can you have a tummy tuck? In general, I say patients can consider a tummy tuck 9 to 12 months after having their child. For weight loss patients, the patient should have been at their ideal and stable body weight for 6 months before considering tummy tuck surgery. Many women that are considering a tummy tuck may also consider breast surgery at the same time. If a patient undergoes breast augmentation, breast lift, breast augmentation, and lift with the tummy tuck at the same time, we often refer to this as a mommy makeover. Another procedure I perform at the same time as a tummy tuck can be fat transfer to the hips. A tummy tuck is great because it tightens the abdominal wall muscles and flattens the abdominal wall. But for women who want a little extra contouring, more fullness to the hips, the look of a more narrow waist, when I'm performing liposuction, I can save the fat and also transfer it to the hips at the same time as a patient undergoing a tummy tuck surgery. Every patient that walks through the doors at Temmen Plastic Surgery is treated as an individual. I don't do cookie cutter surgeries for every patient. Patients considering a mommy makeover should wait 9 to 12 months after having a child and 6 to 9 months after breastfeeding. The great thing about a mommy makeover is that it gives a woman a chance to feel like themselves again. After being pregnant or breastfeeding for a significant amount of time and devoting hours, months, years to childcare and raising a family, it's a wonderful thing to help a woman regain her sense of self and feel confident in her body again.